for USMLE Step 1. The topic of today's lecture is environmental and nutritional pathology. We will begin by looking at the effects of drug and physical injury on cellular biology and metabolism. And by considering tobacco. Tobacco is associated with numerous cancers, of course the most famous association being lung cancer. It is now recognized that the effects of tobacco are involved in the etiology of numerous cancers, including other cancers of the head and neck and oral cavity, laryngeal cancer, esophageal cancer, bladder and urinary tract cancer, GI cancer, and potentially even cervical cancer. Tobacco also has adverse effects on the cerebral vasculature, and of course is involved in the development of chronic pulmonary disease, including asthma and COPD. It also has an adverse effect on the heart with the development of coronary artery disease in people who abuse this drug. There are various carcinogens that are released when you light up, including acetaldehyde and phenol, carbon monoxide, formaldehyde, hydrogen cyanide, and numerous metals, including arsenic, cadmium, chromium, and nickel. Nitrogen dioxide is also a potential carcinic agent that's released. Pathogenesis is associated due to the various carcinogens and their different effects on different cellular systems. Smoke may also have a direct effect on mucous membranes and impairing the work of cilia in keeping carcinogens and other noxious agents out of the lungs. The other major drug that is abused in the Western world is alcohol. One must review briefly the metabolism of alcohol to understand its cytotoxic effects. Alcohol dehydrogenase in the body metabolizes ethanol to acetaldehyde in the gastric mucosa. Cytochrome P450 catalase metabolizes ethanol to acetaldehyde in the liver, and aldehyde dehydrogenase converts acetaldehyde to acetic acid. Remember also that people of Asian descent rapidly convert ethanol to acetaldehyde, which can build up and trigger the familiar facial flushing that occurs when they imbibe alcohol. The various diseases associated with alcohol include hepatotoxicity, which is characterized by fatty change, acute hepatitis, and eventually the development of cirrhosis. Within the central nervous system, alcohol can produce Wernicke's and encephalopathy due to the thiamine deficiency that often accompanies the abuse of this drug. Wernicke's encephalopathy is characterized by the development of dementia, ophthalmoplegia, ataxia and nystagmus, and hemorrhagic necrosis of particular structure in the brain, the mammillary bodies. Korsakoff syndrome is also due to the thiamine deficiency. Unlike Wernicke's, however, it cannot be reversed. It is a form of memory loss and confabulation. You will also see cerebellar degeneration due to the vitamin B12 deficiency that often accompanies alcohol abuse with atrophy of the vermis. Patients who abuse alcohol can also develop a peripheral neuropathy. Beyond the central nervous system and the liver, however, the brain, the alcohol will also affect other organ systems, including the cardiovascular system, where for reasons unclear to us, these patients will develop a dilated cardiomyopathy. The pancreas is also affected with the development of chronic pancreatitis and gastritis within the GI system. Patients who abuse alcohol can undergo rhabdomyolysis, with the destruction of skeletal muscle, and also a effect on the kidney from the overloading of the glomerular tubular system through the massive amount of rhabdomyolysis that occurs. There is testicular atrophy and spontaneous abortion from the abuse of alcohol. And the fetus is also affected with the development of fetal alcohol syndrome, characterized by growth retardation, mental retardation, and birth defects. Alcohol also appears to have a correlation in the development of oral, pharyngeal, laryngeal, esophageal, and gastric carcinomas. This is just one of the effects of chronic alcoholism. This is a slide of the liver where it has been stained with a Masson trichrome stain. The dark blue demonstrates the bands of fibrosis surrounding the regenerating liver nodules that are seen in patients who have chronic hepatitis and cirrhosis following many years of abusing alcohol. Other alcohols can also be abused also by alcoholics who are unable to get a hold of ethanol. This includes ethylene glycol, a common component of antifreeze, and methanol. Ethylene glycol is metabolized by alcohol dehydrogenase to aldehyde, glycolate, oxalate, and lactate. You can see acute tubular necrosis in these patients with tubular precipitation of calcium oxalate crystals. Methanol is often a byproduct from distillers who try to make alcohol on their own. It was commonly found in moonshine. It is metabolized by alcohol dehydrogenase to formaldehyde and its formic acid. It creates a metabolic acidosis, dizziness, with some of the horrific complications being blindness and respiratory depression. This is a sort of standard question that one might see on USMLE Step 1, where the interest of the people creating the exam is less on that you recognize the actual agent as you recognize the necessary therapy involved. Here we have a 16-year-old male with clinical depression who's transported to the ER after trying to commit suicide by drinking antifreeze. Toxicology confirms the presence of ethylene glycol, and the question revolves around what is it that you would give to try and counteract the effects of the ethylene glycol. Here, essentially, one is going to try and essentially outcompete the ethylene glycol by giving the patient ethanol. What is ultimately needed to remove the ethylene glycol from the bloodstream? Dialysis. Other drugs that are commonly abused include things such as cocaine. Cocaine crosses the blood-brain barrier and blocks the reuptake of dopamine from neuronal synapses. It also blocks the peripheral uptake of epinephrine and norepinephrine, which results in excess catecholamine stimulation. Cocaine can predispose patients to coronary artery spasm and also, in pregnant mothers, lead to decreased blood flow to the placenta, resulting in fetal hypoxia. Some of the other effects you can see in patients who are abusing cocaine is an acute intoxication, where they describe experiencing a euphoria, increased energy, and stimulation. However, this can predispose them to the development of seizures and possibly cardiac arrhythmias and cardiorespiratory arrest. Chronic abuse of cocaine can lead to insomnia, increased anxiety, and hallucinations. Due to the increased sniffing of powdered forms of cocaine, these patients can develop perforated nasal septums, a dilated cardiomyopathy, hypertension, and myocardial infarcts, and eventually die either from strokes or sudden death. Amphetamines serve as central nervous system stimulants. Overdose with amphetamines can cause the sort of effects one might expect from stimulation of the central nervous system. This includes sweating, tremors, restlessness, and confusion that can progress to delirium, convulsions, cardiac arrhythmias, and death. Amphetamines can also induce fetal malformations, and one of the drugs that can lead to withdrawal symptoms within the neonate. Heroin is used to suppress anxiety and can produce a sedative effect, mood changes, nausea, and respiratory depression. Overdosing with heroin can lead to convulsions, cardiorespiratory arrest, and death. Intravenous use of heroin is associated with skin and subcutaneous infections. One should always think about heroin abuse when faced with a patient who has right-sided endocarditis with Staphylococcus aureus. Here we have another sort of standard question that one may be asked on an exam such as USMLE Step 1. We have a 23-year-old female transported to the ER after being found down. She has track marks from the injection of heroin, and her boyfriend states that they used heroin about 1 to 2 hours ago. The patient's respiratory rate and oxygen levels are low. The question would then ask, well, what do you need to administer to remedy the effect of heroin on the respiratory centers of the brain? The classic remedy here is naloxone. There are various hallucinogens that people have experimented with over the years. This includes marijuana, which produces a state of relaxation and heightened sensation, phencyclidine, or PCP. This produces effects similar to inebriation, with the patients complaining of disorientation and numbness, and LSD. This LSD produces numerous psychic effects, including visual illusions and altered perception for up to 12 hours. In terms of drugs that may be therapeutic, but that can also have adverse effects on cell biology and metabolism, one must consider the exogenous estrogens that are used often in oral contraceptives. They can predispose the patient to the development of endometrial carcinoma. They've also been proffered when given without corresponding progesterones to have an effect on breast carcinoma. They also appear to predispose some patients to thromboembolism and may have a role in cardiovascular disease. Oral contraceptives, though, when given with progesterone, with a combination of estrogen and progesterone, may actually be protective against endometrial and ovarian cancer, although they still have a conflicting role in the development of thromboembolism and the development of hepatic adenomas. Tylenol, a common over-the-counter analgesic. Its toxicity is predominantly centered on the liver, begins with nausea, vomiting, and diarrhea, followed by jaundice. Overdoses are seen to have liver failure with central lobular necrosis, outlined by the use of a reticulin stain, which shows the collapse of the liver parenchyma. Aspirin can also be abused, leading to respiratory alkalosis and metabolic acidosis. Patients who chronically use aspirin complain of headache, dizziness, tinnitus, mental confusion, drowsiness, nausea and vomiting, and diarrhea. Aspirin, with its role in acylating platelet cyclooxygenase, blocking the ability to make thromboxane A2, can lead to bleeding events. Petechial hemorrhages may appear in the skin and internal viscera. Bleeding from gastric ulcerations can be exaggerated. Remember, aspirin should not be given to children suffering from flu-like symptoms, as it can lead to the development of Ray's syndrome, which is characterized by microvascular fatty change of the liver and encephalopathy in children who take aspirin following or during a viral illness. Other chemicals that you can encounter in the environment include things such as carbon monoxide. There are various sources of this, including auto emissions, and remember it was one of the things that's emitted when you smoke, but also home heaters and byproduct, and carbon monoxide is obviously a byproduct of fires. The pathogenesis is due to the fact that carbon monoxide has a high affinity for hemoglobin, which forms, when it binds to hemoglobin, carboxyhemoglobin, and shifts the oxygen dissociation curve in the blood. This leads to the patient developing a systemic hypoxia. Patients who are exposed to carbon monoxide, say through a house fire or something similar, complain of headaches, dizziness, loss of motor control, and may eventually slip into a coma. They are characterized clinically by the bright red cherry color of their skin. One of the risks of picking your own mushrooms is demonstrated by exposure to Amanita phalloides. This mushroom produces a toxin which inhibits RNA polymerase. Patients present with abdominal pain, vomiting, and nausea. Eventually, they go on to develop a fulminant hepatic necrosis, and then go on without liver transplant to develop coma and death. Arsenic is a famously used poison. Remember that it can be detected in hair and nails long after exposure. The acute stages of arsenic poisoning presents as a hemorrhagic gastroenteritis. There is CNS toxicity with a patient developing coma and seizures. One of the ways in which this poison used to be detected in years before we could check for it in blood, hair, and nails was to test the patient and see if they had what was termed garlic-scented breath. Chronic poisoning with arsenic, these patients develop malaise and abdominal pain. They're prone to the development of peripheral neuropathy and muscle weakness. There are various skin changes that can develop, including hyperpigmentation and particular dermatitis. And then if you look at their nails, they will develop what we call Mies lines, which are transverse bands across the fingernails. Complications of chronic exposure to arsenic, if you don't indeed die from exposure to the poison itself, is these patients can develop squamous cell cancers of the skin and lung. Prior to the 1970s, there was a great deal of concern over children's exposure to lead from paint chips in houses. It is ingested and absorbed through the gastrointestinal tract. The intestinal absorption of lead is enhanced by calcium, iron, or zinc deficiencies. Lead has a high affinity for sulfhydryl groups and competes with calcium ions. It can inhibit membrane-associated enzymes and impair the metabolism of 1,25-dihydroxyvitamin D needed for the proper development of bone. Clinically, how patients present who have had overexposure to lead is with a microcytic and hyperchromatic anemia. You see punctate basophilic stippling of erythrocytes. The overexposure to lead also affects the kidney with the development of renal tubular dysfunction, and also affects the reproductive system, as these patients will eventually become infertile. Similar to the sort of peripheral neuropathies one may see with arsenic, you can develop a foot and wrist drop due to peripheral motor nerve demyelination. And if you look at their gingiva, you will see the deposition of lead at the gingivo-dental line. Various physical injuries can also have an adverse effect on people. One wants to think of these most often in relation to trauma. We tend to define different physical injuries based on their effect on the skin. Hence, abrasions tend to be thought of more as your sort of standard scrapes that children may get into. Lacerations are tears in the skin, often with communicating fragments of skin going across them. An incision, on the other hand, is a clean cut, such as one might make with a surgeon's scalpel or a knife. A puncture is a tubular wound into the skin, and a contusion is simply a fancy name for a bruise. Brain contusions or bruises can be caused either by coup or contra-coup injuries, and will be discussed more in the CNS lecture. With gunshot wounds, remember that entrance wounds are often smaller than exit wounds, and that wounds, close-range wounds, where the barrel of the gun is held against or close to the skin, will show powder particles embedded in and on the skin. Thermal injuries are injuries from burns and can be rated from first to third degree. First degree burns are hyperemia, hyperemic effects on the skin without actual skin damage. Second degree burns are partial thickness burns, generally characterized by blistering and a damaged epidermis. Third degree burns are full thickness burns that affect both the epidermis and dermis. Complications of burns are hypovolemia, curling ulcer, and infection with agents such as Pseudomonas. Remember from what we mentioned in our lecture on neoplasia that UV radiation is a common cause of DNA damage and is a common cause of physical injury. UV light obviously is one of the causes of sunburn and is associated with premalignant changes such as the development of actinic keratoses and malignant changes, the development of squamous and basal cell carcinomas and malignant melanoma. Ionizing radiation from sources such as atomic bombs or from sources such as uranium mining is associated with myeloid leukemias and cancers of bone, skin, thyroid, lung, and breast. In terms of radiosensitivity of cells, lymphoid cells are less than hematopoietic cells, which are less than germ cells, which is less than GI mucosal cells in terms of the development and predisposition to developing a tumor. This ends the first section of this part of the lecture for the Falcon Pathology Review Series for USMLE Step 1 Environmental